This presentation is brought to you by the Muslim Medics Forum, a group of medical students at Leicester. The topic of this video is the permissibility of alcohol in medicine. Bismillah. In the name of God, we start this presentation. The topic for this talk is very complex, and although this is an overview of it to a medical perspective, we highly recommend watching the linked video in the description for a full explanation of alcohol in general use, and an explanation on the principles we will be using to explain our thoughts in a medical context. The three principles are: number 1, that which intoxicates in large quantities, or what a person can reasonably consume in a reasonable time frame, is haram or impermissible in small quantities. Principle 2, actions are judged by their intentions. Number 3, why was this ingredient added? There is some uncertainty as to which ones are permissible and which aren't. Let's start by looking at the term khamr. Khamr is something that intoxicates the mind and is prohibited for Muslims to consume or use. Alcohols are commonly referred to as khamr. However, not all alcohols are khamr, and not all khamr is alcohol. The term alcohol is given to any chemical compound that has an OH group on it. These come in many different types. The most common alcohol that intoxicates is ethanol, or ethyl alcohols. They are used in alcoholic beverages, but can also be used as solvents in the medicines, food and cosmetic industries. It is impermissible to use ethanol on its own or alcoholic drinks as medicine. All of the alcohols found in the excipients or ingredients of medicines are chemical alcohols. This means they are synthetically produced for the purpose of use as a solvent, to extract the desired ingredients, to preserve it and protect it. When used in small quantities, these are not khamr. Examples of other alcohols are propylene glycol and glycerol. If the quantity of chemical ethanol is so minute that it will not intoxicate you in the medicine, it is not khamr and is permissible to take, providing principles 2 and 3 are also met. So, the intention of the ethanol is to be used as a solvent or inert excipient, and not there for an active role like sedation. If possible, you should inquire about the role of the ethanol in your preparation. Any medicine regardless of ethanol content when used for abuse is impermissible. Let's take some scenarios. Scenario 1. Liquid medicine that contains ethanol which is prescribed by a doctor that is necessary for your health and there are no alternatives is permissible providing the doctor confirms the 2 points mentioned. For example, diazepam solution for injection. Scenario 2. Liquid medicines that are not necessary for your health that contain minute or more quantities of other alcohols, like propylene glycol and glycerol. These are permissible. All medicines that contain ethanol in them have a special mention in the Patient Information Leaflet, PIL. If the medicine has ethanol at less than 0.1 grams per dose, it will state this without any further detail. If it has more than 0.1 grams of ethanol, it should state the weight of the ethanol in grams, along with an equivalence to a quantity of beer or wine. Look at the PIL for this information. Ask your pharmacist if you need help with this. Scenario 3. Medicines that contain minute amounts of alcohol are allowed. For example, less than 0.1 grams, as this is a very small quantity and will not cause any changes to the state of mind. Examples include Dacchar and oral gel. Some medicines have slightly more ethanol, like the following. Piriton has 0.25 grams of ethanol per dose, and Benylin dry cough night has 0.24 grams per dose. These are still very small amounts of ethanol and will not lead to intoxication. If you do not feel comfortable taking these, there are generic versions we have come across which contain even less ethanol than the ones mentioned. Scenario 4. Liquid medicines that are not necessary for your health that contain higher amounts of ethanol. This will vary depending on the medicine, and it is important to look at the PIL. For example, Night Nurse solution contains 2.9 grams of ethanol per dose. This is equivalent to 72 ml of beer and 30 ml of wine. The effect of this amount of ethanol will vary depending on many different factors. At this level, it will not intoxicate you. However, a study found that ethanol at this level, if equated in an average 70 kg male, started to have minor effects on a certain motor skill. The same dose would give a 50 kg female nearly double this blood alcohol concentration, where there is a possibility to start causing mild euphoria. See the description of the video for more detail on this. Since the effects of the ethanol in this preparation are questionable, and it will vary from person to person, and there are plenty of alternatives immediately accessible, we would suggest to refrain from using this solution. We need to use our judgment, take sensible precautions, and err on the side of caution. Scenario 5. Some mouthwashes contain a very high amount of ethanol, and although the absorption through the mouth may be small, you should avoid it because there are plenty of alcohol-free alternatives. Scenario 6. Oral gels. There is little absorption through the mouth, and the amount of ethanol is usually minute, and if so, this is permissible. Examples include Calpol teething gel. Scenario 7. Hand sanitizers containing ethanol are permissible. In all the above scenarios, you need to look at each medicine carefully and use your judgment and always err on the side of caution if needed. Remember to keep your intentions pure. In summary, look at each medicine on a case-by-case basis. Most medicines have a small amount of ethanol and are permissible. Some medicines have a large amount of ethanol and the use of these should be looked at carefully. Bismillahirrahmanirrahim.
يسألونك عن الخمر والميسر قل فيهما إثم كبير ومنافع للناس وإثمهما أكبر من نفعهما ويسألونك ماذا ينفقون قل العفو كذلك يبين الله لكم الآيات لعلكم تتفكرون